In this video, you're going to learn how to add $30,000, even $40,000 or more net profit by making just a few simple tweaks in your financial arrangements. I'm going to share 8 gems, and we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
Greetings from Planet Gems. I'm Dr. Tom Orent, aka the Gems Guy. 20 years ago, I was $1 million in debt, divorced, being embezzled. I came within 3 days of bankruptcy. Good dentist, but I was clueless when it came to the business part. Almost lost my practice and my home, and then I stumbled across a gem, and then another gem, and another, and they actually helped. So I began actively searching out gems, strategies to help me rebuild my practice and my life. At age 46, I was able to retire. Since then, my passion has been helping dentists help your patients to say yes to more of your best dentistry, help you have more fun, and make a lot more money. If you're a general dentist and you'd like to make $30,000 or $40,000 more net profit while working the same or even less, then you're in the right place. Gem number 8, your barometer of successful creation and deployment of financial arrangements. You want to determine whether you have optimal financial arrangements in place and if your team is doing a good job of implementation. To make that determination, you need to know which numbers are the most accurate measure: production, adjustments, adjusted production, collections, net collections. Discover which 2 parameters are most important and what ratio is a reasonable goal for your team. When it comes to knowing how well you're doing collecting the money, one of the most important metrics is your collections ratio. Write this down. Collections ratio equals net collections divided by adjusted production. Gem number 7, collections ratio versus gems ratio, and why you'll want to strive to collect every penny due and more. If you've been with me for any length of time here on Planet Gems, well, you've likely heard me say that while you don't want your gems ratio, which is accounts receivable divided by your average monthly net collections, to rise much beyond 1.1 to 1, you're hurting the growth of your practice, your revenue, and your income if your accounts receivable drops below 3/4 of 1 month's collection. Diminishing gems ratio or low accounts receivable, the nearly cash practice, it feels good because nobody gets away without paying, but the reality is it's one of the worst things you can do to your practice and your revenue growth. The stricter your financial options, the greater your number of patients simply who won't be able to afford to accept and move forward with your recommendations for care. The paradox: while you don't want to restrict growth by having unduly strict financial options, it's in your best interest to collect every penny owed, just not necessarily all at once. If you're finding this helpful, I'd really appreciate if you could click like and if you'd share this with other dentists. If you're a general dentist, join our complimentary community of dentists around the globe who share gems to improve patient care, have more fun, and make more money. We'd welcome you to join our free Facebook group, Dental Goldmine Mastermind. There's a link in the description below. Gem number 6, how to routinely collect even more than you're owed. In my Framingham office, our collections routinely ran 101% of our adjusted production. So how do we do that? Easy. The very first financial option that we would offer patients was a 5% prepayment courtesy. If patient's portion would be over $2,000 and you'd like to pay the estimated portion for the whole case at the start, we'd reduce what you owe by a 5% prepayment courtesy. In order to motivate my team to make sure that this was offered to every patient, I offered a 1% prepayment courtesy bonus to any team member responsible for making financial arrangements. The majority of our 35 team members in my 2 practices were cross-trained, and they loved going for prepayment courtesies. The largest one I remember, it was a $500 bonus to Isabel, my office manager in the Framingham practice. Patient's name was Jim, had a $50,000 reconstruction. Isabel explains the financial options. I presented the case. On his way out, Jim hands Isabel a check for $50,000. She earned a $500 bonus as a result. Don't forget to subscribe so you won't miss a thing, and hit the bell notification so that YouTube will let you know when I release my next video. Would you like to protect your adult patients against cervical caries by getting 80% acceptance of fluoride paid willingly out of pocket? With just 7 simple sentences, you'll add $40,000 per hygienist per year. That's $200,000 pure profit over the next 5 years. How could that change your lifestyle? Done for you in just 30 minutes. Enjoy a free one-on-one 7 simple sentences fluoride verbal skills training for doctor and team. Get your free live training at gemscripts.com /2. There's a link in the description below. Gem number 5. This secret ingredient ensures you get paid. Having signed financial agreements with every patient prior to commencing treatment is a great start. But without this additional secret ingredient, you still may not get paid. The additional secret ingredient is the instrument of payment. Now, there are many options for the instrument of payment, including but not limited to authorization to charge her credit card X dollars on Y dates, post-dated checks in states that allow it, ACH or EFT, which is also known as electronic funds transfer, authorizing you to charge X dollars on Y dates, and pre-approved signed third-party financing. Gem number 4. 3 steps ensure you'll never again have to bill your patients. You already know the first 2 steps: sign financial agreements and the instrument of payment in hand prior to commencing treatment. But what about that pesky insurance? Even if you use my generic estimator, which by the way eliminates the need for 99% of all predeterminations, you'll still occasionally run into cases where insurance paid less than we anticipated, maybe even nothing at all. The third secret to eliminate the need ever to bill? The following must be on your financial options form. The total fee charged is your obligation. Once your insurance is paid, if you have a credit, your credit card below will be credited that amount. If you have remaining balance, your credit card will be charged. If your insurance carrier has not paid within 60 days following a claim, the entire balance will be charged to your credit card. Gem number 3. This fail-safe ensures nobody slips through the cracks without paying for rendered care. Doctor, you are the fail-safe. Walk into the room, greet your patient, then look for, check, and reconfirm number 1, which care are you supposed to be starting today, and number 2, the existence of signed financial arrangements, including the instrument of payment. If you can't find signed financial arrangements and documentation of the instrument of payment, excuse yourself from the room. Head out to the front desk and ask if perhaps the documentation was completed last minute this morning on the patient's way in, and maybe it just hasn't made it into the chart yet. If that's the case, terrific. Confirm that it's in order, go treat your patient. But if your team members missed taking care of it when they were scheduling, missed it during the prep during yesterday afternoon's preparation for today's morning huddle, and then again they missed it when they were seating the patient this morning, then your business team member is responsible for walking into the room and getting it taken care of right now. Is that uncomfortable? Yep. Is it possible you may have to dismiss your patient if upon being asked to actually pay for her care, she's unable or unwilling? Yeah. You could lose the treatment that morning. You may even lose the patient. But this won't happen more than once or twice because no team member is going to want to be put into that situation. What do you do to help ensure you collect what's due? Share your gem in the comments below. If this has been helpful so far, you'll love the in-depth training, financial options and exactly how to sell them, and the resource, Financial Options Worksheet and Verbal Skills. If you're a GEMS Family Platinum, ask your personal concierge for access. But even if you're not, I'm happy to share them with you for free. Take a free 6-week test drive of Platinum. During your first 6 weeks, deploy even 1 gem, and you could increase $40,000 annual revenue. Gems are fun, they don't take much of your time, and they're really easy. You'll pay just $6 one-time shipping fee. Gems are so easy, I'm offering you a 10 times money back satisfaction guarantee. All I ask is, speak with your GEMS concierge. Together, you guys choose one easy gem to deploy during your 6 weeks free. If for any reason you're not satisfied with GEMS during your 6-week free test drive, just let me know and I'll refund $60. That's 10 times your $6 shipping fee. To get your 6-week free test drive of GEMS Platinum, go to gemsyoutube.com. There's a link in the description below. Gem number 2, how to ensure your associate doctors and specialists take responsibility to ensure that appropriate financial arrangements have been made before they start treatment on your patients. It's one thing to be the fail-safe when you, the owner doctor, are directly involved with the care, but it's entirely different when you're not going to be directly involved when new treatment is started by your associate or in-office specialist. The fix is simple. Write or rewrite their contracts to include a clause which reduces their compensation if or when you don't get paid. Heck, if a patient's unhappy with the care or demands a refund, or if your associate starts the treatment without taking the time to make sure that financial arrangements have been made, they should be held responsible. If you're paying your associate based on a percentage of collections, then they already are being held at least to a degree financially responsible. But a case can be made for paying associates a percentage of adjusted production instead. The details are far beyond the scope of this discussion. Suffice it to say, I paid associates and hired gun in-office specialists on production later reconciled on collections. It's amazing how well our doctors focused when they had financial skin in the game. Pete Dawson wrote the foreword to my first book, and Gordon Christensen wrote the foreword to my fourth book, Transform Your Dental Practice from Coal Mine to Gold Mine. It's on Amazon for $16.97, but I'm happy to send it to you for free as my thanks for your being with us here in the Dental Gold Mine. I'll even cover the shipping. With just 2 of the gems in this book, you could add $50,000. While available, claim your free book at freegemsbook.com. There's a link in the description below. Gem number 1, even your team must be held financially accountable for allowing patients to start care without first getting signed, executed financial agreement. Now, I'm not an attorney and you should check with yours. And of course, I would never dock a non-doctor team member's regular pay for not getting financial arrangements done. But we did have them buy into the process by reducing their bonus based upon less than acceptable collections ratio. I covered this in detail in my video on team bonus system, but the short version is set a collections ratio target, let's say 95%, below which their team bonus payout upon hitting goal is reduced by 25%. Now, it's a fallacy to think that only front-end business team members are responsible for collecting the money. When every team member and doctor in your practice has skin in the game, you'll be collecting every penny due and sometimes more. Hey, thanks for joining me here in the Dental Gold Mine, and remember, you're only one gem away.